Hello, everyone. Thank you so much for joining us today. We have a wonderful group already forming. We saw we had like 50 people in the waiting room, which was very exciting. So, thank you for spending your Tuesday afternoon or Tuesday morning or Tuesday evening, depending on where you all are. And this is our second webinar of our three-part series with our friends, Allie and Kate from Children's Funding Project. I'm Megan Schmelzer. I am with 0 to 3 on the Infant Early Childhood Mental Health team, and we are delighted to bring this series for you today. I'm going to tell you a little bit about one of the main reasons why we're here, and then I will give a little bit of background on Allie and Kate, and then hand it over to them to talk all about cost modeling today. I'm so excited about it. Um, so yes, please, if you haven't already, put one of our favorite things is to see where everybody is calling in from. So please feel free to say hello in the chat. And also a bit of housekeeping. If you have questions, we will have time for questions and answers at the end. Please put them in the Q&A box because hopefully, like last time, the chat box just gets so busy that sometimes it's hard to keep up, and we don't want to lose your questions. So um, remember to put it in the Q&A box, and we're ready to get started. So again, I'm Megan, and I want to tell you a little bit about what we love to call our financing policy project here at 0 to 3. And in just a minute, I'll put a link in the chat, and that'll give you a bit more information. But that is how we all came to be here today, and in partnership between 0 to 3 and CFP. And our financing policy project is something that 0 to 3 started almost 10 years ago now, which is pretty remarkable, and where we bring together state teams and we come up with action plans and we provide support and resources and connections to wonderful national partners like Allie and Kate to talk all about how do we support and create solid funding streams around and policies, I should say, around infant early childhood mental health systems and services. And so we have worked with now to date, 36 states have been in this policy financing policy project with us, and we are about to in early 2026 we are about to release cohort 5. So if your state is not a part of the FPP and you are interested in that, please let me know. I will again put the link that has the list of states that have participated up to this point and in the chat along with my email address. And so again, if your state is not on that list, please let me know. And if you're interested, we can talk more offline about that. But so that's how we come together today. And obviously, financing is the forte of Children's Funding Project. And we have learned so much in the first webinar with our friend Amelia, and she was talking all about finance mapping. And today is around cost modeling. And I will also put a link in the chat to the third webinar, which is going to be all about tax policy, which is so exciting. And I never thought I'd get excited about that. But they just know how to make it fun. So with that, I'm going to tell you a little bit more, just a little bit more brief information about Allie and Kate, and then I'll hand it over to you two to take it away. But for those of you who joined us for the first webinar, Allie will look familiar to you. She, again, is a senior manager of partnerships. She comes to us from St. Louis, Missouri, and she leads CFP's efforts in building and sustaining relationships with national, state, and local organizations to work to advance equitable outcomes and equitable opportunities for kids. Like myself, Allie is a social worker, so love to all the social workers out there. And she spent 2 years serving in the Peace Corps in South Africa. So just a little fun fact about Allie. And Kate is not new to CFP, but new to us. And Kate is a senior manager of cost modeling. She comes to us from Vermont, where she lives with her family. And cost modeling is her specialty. She's focused on early care and education, finance policy, and worked with the Illinois Governor's Office on Early Childhood Development and came up with a cost modeling for their quality rating improvement system. And we're hoping to add infant mental health to your list of specialties now too, Kate, and welcome you into our world with us. And fun fact that I found out, you are a doula as well. So I don't know if doula was part of CFP's prerequisite, as I know Amelia is also a doula, but you are in good company, and I would imagine you might have some other doulas on this call today as well. So with that, I will hand it over to the two of you, and thank you in advance. And again, we will put your questions in the chat, and we will follow up at the end. Thanks.
Thank you so much for having us, Megan. We're super excited to be here for this next webinar. And yes, at Children's Funding Project, we are a bunch of people who care deeply about babies and children. Got so fired up about the underfundedness of it all that now we're deep in the wonky public financing space. So Kate, if you can share the slides, I can kick us off. And then we'll hear all about cost analysis and modeling today, which is super exciting. Can't get the slides.
I literally just had them up and then went to share them and then they disappeared. I'm so sorry.
I might be able to.
Here we
Here,
go.
let's see.
Here we go.
Okay.
Um,
So Children's Funding Project, we're formed in about 2018. We are laser focused on all things related to the money going to children and youth from cradle to career. So we work with states, local communities, and Native nations to do what we call strategic public financing. And I can share.
here, I got it.
Okay.
Oh, it won't let me. I'm sorry. I did find it, but it won't allow me to share.
That's okay.
It
So
says
let me just do share screen.
over there. Is it working now?
Yes, I allowed multiple presenters to share. Should work now.
Thank you. Sorry about that.
All right.
Okay.
So, Kate, I'll just keep sharing for now, and then later when we'll switch to you. So so what we do is called strategic public financing. And so what that is taking a set of goals, policy priorities, the strategic plan in your state or community, adding a price tag to those goals, and then finding ways to cover the costs. So there's kind of like a mantra at Children's Funding Project. That's what gets budgeted gets done, or probably even more true, what doesn't get budgeted doesn't get done. So we're all about adding a price tag to those goals. And another way to talk about strategic public financing is really just helping answer these three questions, which sounds simple on paper, but I'm sure you all know aren't always super simple to answer. So the three questions being, how much funding supports our goals right now in this case, for infant and early childhood mental health, it's statewide. Second question, how much will it cost to fund our goals in full? And then the third question is, how do we fill the gap between current funding and fully funding those goals? So in the last webinar, we learned all about fiscal mapping and how that's an important step to understand current investments in infant and early childhood mental health. Today, we'll be talking all about cost. And then the third webinar about sort of tax policy 101 is really about how we can get in the game and generating new revenue to fill funding gaps, because there's always a funding gap, and we need to grow the pie that's available to fund these things. So our plan of attack for today is Kate's gonna help define what we mean when we say cost model and sort of share a story of what that looks like in a community. We're gonna do an activity where you all can practice setting a goal for a hypothetical cost model for IECMH in your state, and talk through a little bit about the types of supports we can provide at Children's Funding Project and what actually making your own cost model looks like. Our vision here is really to, build the capacity across the country of people who are able to do this for their states and communities, so that we can get real about the big number of what it's going to take to fund programs and services in full. And we'll have plenty of time for discussion too. So I think we wanted to kick off, before I pass it to Kate, we wanted to do a really quick poll just to get a sense in the room of folks' experience with different types of cost analysis or cost modeling. So I think Renata is going to kick off a poll for a second. It's just one question. All right, so if you could just answer that to describe your experience with cost analysis or modeling. All right. Think, give it another second, and then I think if we close the poll, we'll be able to see the results. Okay, great. So about 10% have participated in or led cost analysis or modeling in your state. So that'll be great if you can, share experiences along the way in the chat or discussion. Some folks have dabbled, and most people know about this as a method, but need help applying it to their community. And then some people are new to it. So this is an awesome spread. Yes, we'll send out slides after the webinar, and I'll just pass it to Kate to dig on in. So thanks for doing that poll, everybody.
Oops. Thanks so much, Allie, and thanks, Megan, for the introduction. I am excited to see the varying levels of experience with cost modeling. I am definitely a cost modeling nerd and could talk about it all day, and I'm very excited for questions that will pop up during our time together today. So I'm going to dive into really what cost modeling is and also what it isn't. It's a term that's used a lot and people have kind of different definitions of it. So I want to clarify what we're talking about at Children's Funding Project when we do cost modeling. We're going to talk about how it can help you answer questions about funding your goals. What is the cost of your goals or priorities for your mental health systems in your state or community? We'll talk about what the process is for developing a cost model and what are some of those core components, including the critical first step of developing a cost modeling goal statement. And we'll take a little bit of time to look at how communities in the state and states are using cost modeling to support revenue options and revenue research and taking really strategic actions to stabilize and grow stable funding for programs and services, which is, I feel like it's particularly inspiring right now while we're in this moment of funding instability. And we'll also do a little activity around goal setting so you can start to think about how to apply this for your work. So let's start out with what a cost model is. Cost models offer a really in-depth look at the true cost of equitably implementing, maintaining, or expanding a program or a service for kids. So it moves out of what the programs typically charge or what they're reimbursed at and looks at really what is the true cost of implementing that program. So it examines costs related to all the program requirements, the staffing needs, employee wages and benefits, any facilities, rental, utilities, transportation for professionals that do itinerant work, number of expected participants. So all these, we kind of call it an ingredients method. You take all these costs that are associated with the program and we build it into a tool that has variables that you can manipulate, and it allows you to see the cost impact of various programmatic changes or policy changes. So some of the most common reasons that states or communities invest in a cost model are to compare the actual cost of running that program with whatever the market cost or the market tuition is or reimbursement rate. Often it's used to set subsidy rates. It's used to often cost out grants or contracts or certain initiatives. It can be used to cost out, as I said, the impact of a policy change. For example, changing like caseload requirements or implementing family engagement strategies within a certain program. And then most exciting for most people is it's often used to advocate for increased investment in programs or services for children and families. And I do also want to take a moment just to clarify the difference between a cost model, a cost estimation, and a cost study. These are terms that are used a lot, and sometimes they are used interchangeably. A lot of people have seen it within the early childhood space. It's been used a lot with childcare, particularly because of the federal push towards states doing a cost model for CCDBG for their childcare programs. But we are really trying to expand it out into other programs and services and ages and groups. But just to clarify what the difference is between these terms that you probably hear a lot, a cost model is a dynamic tool that allows you to explore, like I was saying, these kind of what if scenarios. So what if we required all childcare programs to provide 2 hours of mental health consultation services to every classroom each week? Or how much would it cost to support living wages to increase or increases up to like a living wage increase for home visiting professionals? So it requires fairly granular data collection so that you can ensure that, first of all, you can model out these what if scenarios appropriately, but then also to ensure that the model is accurately reflecting the true cost in your whatever community geography you're looking at. A cost estimate, on the other hand, is an approximate cost figure. That is a really great choice when detailed cost modeling isn't needed or if there isn't time. At Children's Funding Project, we help a lot of communities with cost estimation. It is by no means a less valuable tool. It can also be built with some kind of flexibility in it to explore different scenarios, but the main difference is that it's often based on existing data. And it generally has a lot more assumptions in it to fill where there are data gaps. And then lastly, a cost study is a static point in time cost analysis of a program or a service. It does also require pretty detailed data collection, but it's generally presented as a report. So it's not a tool that can be manipulated or easily updated. One that people might be familiar with is Vermont put out a really big cost study that was really exciting for their early childhood system. It estimates the cost of achieving a high quality system for the whole state, but it can't be manipulated. It's a report, and then if you want to make changes, a new study has to be done in the future. So just to clarify, just wanted to tell that's what the difference is between those terms. We are focusing on the cost model. So I'm saying this word a lot, and people are like, what does a cost model actually look like? So I wanted to take just a quick moment to share with folks what cost models look like when we're working with places to build these tools. So I'm going to stop share. I'm going to show two different cost models. I also want to clarify that um, there are more cost models being built in other programs and services. Right now, the bulk of them are in childcare. So I'm going to show some of the childcare ones we've built. There are more recently, we've seen some home visiting. We've worked on some early intervention. Those really need to be built out more. So right now I'm going to show you one for childcare programs, but just know that these same concepts can be applied to the types of programs and services that you all are doing. Okay, so let's see. Here is, Allie, give me a thumbs up if you can see it. Okay, thank you. Here is a state cost model, again, focused on childcare. This is focused on a center one. You get a lot of granular data. You develop the goal for it so you understand what the results are that you wanted to see. It varies by project to project. This example one, this state wanted to really understand the true cost of care by child and by classroom, and they wanted to explore some different scenarios with it. So you can see here in the blue
Hey, can you zoom in
table,
a little bit? You got a request to zoom a bit.
zoom in.
Yeah,
Okay,
thanks.
yeah. Go there. So I'm going to show you first these blue tables. This was how they wanted to see results. You can see it in all different ways depending on what your goal is, but they wanted to understand the per child cost by age group, the per classroom cost by age group, and then compare it to the subsidy rate by child, by classroom, and then also if they looked at the whole cost difference for a program between their revenue and to see how much of a revenue increase they needed in order to be whole at the end of the year, to not be in the red. They also wanted to explore it in two different ways. The first is with current salaries, and then below that is same type of cost model, but looking at a program with recommended salaries. So on average, how much does it cost in this state if you are running a child care center and you're paying wages and benefits to your staff to attract and retain qualified staff? You can see the cost difference. Um, let's look at infants and toddlers from about 20,000 to 30,000. Now, this is also in one scenario. They wanted to understand different things. So they, first of all, they want to understand differences in different regions of their state. So you can explore how it changes when you look at different regions of their state that have different types of economies. They also wanted to look at quality levels of their QRIS system. So if they looked at just licensing, it was just under 17,000 for an infant. If you went all the way up to the top quality level, it was about 25,000 for an infant. So those were just some of the pieces they wanted to look at. They also had priority populations. Again, this is why we'll get to the goal setting exercise, but the what if scenarios are kind of informed by your goal for developing a cost model. So they could toggle in and out of whether they were serving priority populations or not, whether they wanted to do any initiatives around contracts or subsidy or grants for programs that in their state that were serving priority populations. So it just included a few more like mental health consultation, family engagement, things like that, and that was costed out. So you can see this gets really granular, and this was the result of the initial cost model. What we often do from here is we work with them to then extrapolate out to what is their bigger goal for their system. So I'm going to stop sharing this and share one more model. And then I'll stop sharing models, even though I could literally share spreadsheets all day.
And Kate, while you're pulling that up, there's a question in the chat. Where do you go to obtain the regional economic differences in a state? That might
Great
come up when you talk
question.
about this. Yeah.
Yeah, that's generally determined by the data collection. So two things, either if your state already has like predetermined kind of breakout. This one again was based on childcare subsidy. So they had different regions that their state was broken out, like urban, rural, semi-rural. But sometimes you don't know if there's a regional difference. So that goes to data collection. If it's something you want to explore, you would collect the data where programs or providers are giving you their county or zip code, depending on how granular you want to get. And then we can analyze the data based on those geographic differences to see, is there a huge facility difference cost in one part of the state versus another? So it all depends on how you want to look at it and if you want to go to that level of geographic cost differences. So this was an example of a state that we worked with that then they had that type of cost model I just showed you to understand the per child cost at different levels of quality and different compensation scales for the workforce. And so this was taking it and putting it into a full system model. So toggling around, you could look at if they were serving families under 250% of the federal poverty level in licensed level of care. That's how much the state was putting towards paying for it. They had a current investment of about 120 million. And so increasing to this level would require an increased investment of about 230 million. They're setting their sights big, right? They wanted to understand the whole, knowing they can't get there in their first year. It's why we kind of have these stair-stepped income eligibility levels and quality levels, but it allows them to use the model over time to stair-step into where they want to be, which is really full population, having access to services with the best level of quality and the best compensation scales for the workforce.
Okay.
And it goes up to 1.4 billion. Eye-popping, absolutely. They knew they couldn't get there. And again, that's why they had these different, wanted to understand how to stair step into it. Again, this one was focused on childcare. So we, just to break down what is being included here, we had center costs, family childcare costs, the additional cost to serve children with disabilities, the additional cost to serve children adequately that are dual language learners, and then lastly, the additional cost to incentivize non-traditional hour care for families that need that. And actually, I guess lastly is infrastructure and support. So like kind of those full system costs that need to be in place to help expand the system to reach all children. I am definitely curious if people like seeing this, which is from the child care view, if people have thoughts and ideas about what they would want to model for their system, what some of these variables or policy scenarios are that you might want to see. And definitely put in the chat if you have some things that you would be curious about modeling in that way. I will go back to the chat, but I'll keep sharing the slides for now. Okay. I did see one question. This is about US, and that is correct. This is right now looking at a US system. Okay. And now, so that's a big, lovely spreadsheet. I didn't even get into all the back tabs. They generally have about 10 tabs that feed into that results tab that you just saw, which is not, it's great for any of us that love all this kind of data and want to understand this cost information. But you do need to have a way to share this information so that it's clean and understandable and compelling if you're sharing it with other advocates or partners or elected officials. So I wanted to share this example. This was from the cost model I just showed you, where they decided one year that they really wanted to focus in on infant and toddler care. So we used the cost model to help them understand the true cost of adequately investing in infant and toddler care. Their goal was to improve the subsidy rate and to encourage more providers to care for infants and toddlers, and also to attract more infant and toddler teachers. So the results of the cost model, those per child costs, were multiplied out to capture both current infants and toddlers, as well as their goal number of infants and toddlers that they wanted to reach. And what you can see on the slide is that it shows you the full cost, right? The full cost to serve everyone is $251 million. And within that cost, it breaks it down that 17.5 million would be covered by parent co-pays. 159 million is covered by, currently that's how much infants and toddlers are getting from the subsidy program. So the gap that needs to be filled is somewhere between the range of 75 to 100 million. And so then the state was able to use this information to source funding that would be large enough to fill that gap. And there's lots of different ways, obviously, you can present the data for different audiences, but just this is kind of one example of how that spreadsheet translates into a communication piece. Then just really quickly, I wanted to talk about how cost models are used. So to give people some insight into why you invest in this kind of technical, granular process, it can be used to achieve a lot of goals. It allows people to understand the impact of different program options. So like you can see here some of the success stories, and then I'm going to dive into one very specifically. So Boston has been using it to develop a funding formula for their UPK program so that teachers that are in centers and doing UPK classrooms are paid parity with public school teachers in Boston. Delaware has been using it to, over time, kind of like I showed you, stair step into increases in income eligibility for families to qualify for the subsidy. They're also looking at using it to understand the cost of categorical eligibility for certain populations, like children in the foster care system or children of childcare providers. And they've been then sharing it with the governor's office and their state data office to give them really data-backed information. And then lastly, Travis County had used cost modeling to support leveraging revenue. So they used the cost model to demonstrate this gap between their current funding and what was necessary to achieve the level of access and quality of childcare they wanted in their county. And I'm going to kind of dive into that because it's a really inspiring story that just happened recently. Travis County, I know we have people from all over, but our folks that aren't from Texas or aware of it, it's home to Austin. Most people know Austin. And they're really going through a transformative period. After it did take a lot of years of cross-sector collaboration, but they are shifting from having the state's most expensive childcare to becoming the first place in Texas with the dedicated funding for children and youth programs. This happened through a ballot measure that passed in the last election, November 2024. The ballot measure increased property taxes by 2.5 cents for every $100. And the funding from that it goes into a dedicated fund that will support affordable, high quality childcare. It'll support after school activities and summer programs for children from low income families. So again, an example mostly on childcare, but it can be used for a variety of different things, of expanding infant and early childhood mental health consultation services or home visiting services, or whatever it is that you want to prioritize in your area. This initiative is going to generate over 75 million annually, and they're able to cover a lot more families through this. So I want to share just a little bit of the cost modeling side that supported them in getting there. The first step, I've kind of mentioned it a few times, is that the first step is building a strong foundation. And so this means having a strong goal statement. So Travis County partnered with us to help them build this cost model, and we walked them through building their goal statement. So articulating a clear, specific, and measurable goal statement that explains the purpose for their cost model. Without doing this, it seems tedious, but without doing this, you risk developing a cost model that actually doesn't inform your purpose or answer your question that you're trying to get answered. So goal statements typically have a key action. So here, estimate the true cost. That was their key action that explains the overall purpose of why they're doing it. It has a what, so like what program, service, or initiative you want to support. The who, which is the population that's going to be focused on or impacted by the cost model. And then where, just the geography, the expanse of what you're trying to cover. So you can see Travis County had estimate the true cost of providing Texas Rising Star, that's their quality rating system, 4-star quality, licensed home and center-based care, Head Start, early Head Start, and pre-K. Those were the who, the what. And then for income eligible infants through age 4, that's the who in Travis County. These were their cost modeling results, pulled out of their Excel tool. And what you can see here, again, if we just focus on infants, is that the cost currently for a quality level 4 program, the cost for an infant, true cost, was about $23,000 per year. If you took that same program, but were paying benefits and better wages to the staff, as well as lowering staffing ratios to prevent burnout and help classrooms feel more supported, the cost goes up to about 46,000 per infant. And what you're not even seeing on here is that these are the true costs, but the subsidy was about $17,000 for an infant annually for families that are using the subsidy system. And the average market rate or the private pay tuition was even lower. It was about $14,500. So you can see it's a pretty big difference between what is being paid versus what you actually discover is the true cost when you put all those ingredients in there. They use those numbers and again, it multiplied it out kind of like that system level model that I showed you. And we're able to see that it informed expanding slots, expanding care in early morning, evening, and weekend hours, and building quality and capacity. And all of those came out to about 77 million annually. So it was successful. Their ballot measure passed. Woohoo. It's going to bring in about 75 million annually to start accomplishing some of these goals. And I bring this up because there are a lot of ballot measures that don't pass. We don't know 100% why this one did and others didn't. They did have a cost model that was really helpful. They feel like this was what pushed them to be successful, whereas some of the other ballot measures that didn't have a cost model with this kind of data backing potentially weren't as successful. They felt like the findings from the cost model informed policy discussions with local government leaders. They were able to present really concrete financial data. Advocates were able to demonstrate how much investment was needed. It provided a justification to their tax rate ratification election board. I'm saying that name wrong, but you know what I mean. That clearly demonstrated the amount of funding needed to achieve the goal relative to the yield of this tax rate hike. So they really felt like having the leverage of this cost model was instrumental in their success. So jumping over the goal setting, and I think I'm going a little over time, so I'm going to go faster. Jumping to the goal setting, this was the first step that we did with Travis County. It's really important to have something that articulates a measurable goal, a clear goal that explains the purpose of why you're doing it. So we're going to do an activity where we take some time so you can think about what a goal statement would be for your program or your system. I want to go back to what's generally in it again. So that is a key statement. So explains the overall purpose of like why you're creating it, expanding a program, increasing quality, lowering caseloads, whatever it is. Then the what. So what type of program service, who is going to be impacted, and then the geography. I already showed you the Travis County one, but for folks that want to see it again, estimate the true cost of providing 4-star quality licensed home center, Head Start, early Head Start, and pre-K for income eligible children in Travis County. So we are going to, or Allie will drop a goal setting worksheet into the chat. And I would love it if folks could take about, what do we have, like 5 to 10 minutes.
Yeah.
And try filling out the goal statement worksheet. So the first kind of walks through, the first page or two is the background information I just gave you. So you can skip through that. And then there is a chart where you start to check off answers. And if there's an answer there that your answer isn't there, we generally left a space where you could fill in what would be right for you. So going through that, it kind of walks you through those choices around the who, what, where, what action. And then at the bottom, you can try developing your own goal statement. I'm going to let folks work on it, but please, if questions are coming up while you're working on it, let me know.
Hey, while they're working, lots of great questions in the chat about, tailoring this stuff to IECMH. So I think we worked with the 0 to 3 team to tailor this cost modeling goal guide. So hopefully hopefully that will be helpful in developing your goal statement. And some people kind of already even have a goal statement written in the chat. But when we get to discussion, we'll be excited to hear reflections from the group after doing this activity about what further we could add. So yeah, Kate, I don't know if you want to scan those questions while they work.
The first one I saw is about cost model. Is any cost modeling being done for family resource centers? I don't know the exact definition of what a family resource center is, but I'm thinking it's pretty similar to one that we did that was around kind of family resource, like community collaboration hubs, which might be similar to that. Which, yes, we developed a cost model that was really innovative for them, gave them a lot of different options. So if it's something similar to that that connects families to different services in their community, definitely something that can be cost modeled.
Oh, sorry, I'm not able to open or download the document. Can anyone drop in the chat if you are able to download it? Okay, let's see here. Okay, some people are. I'm gonna drop it. I'm just gonna try it again just to see. And then I'll stop talking so people can read. Let's see. Okay, so there's a good tip here to save it to your desktop first and then open it.
I see a question about I love that UPK teachers are receiving pay comparable to DOE. Are any states doing this for daycare centers? There are states that are working towards this. I don't have the full list in front of me. The one that I know was kind of leading the charge, I think, was Minnesota. They were one of the first states to develop a pay parity scale for childcare providers. So I know that that's something that they're trying to do, and I'm sure there are others as well. There are a lot that have at least developed those pay scales. Illinois, I think, has, and are in various levels of trying to reach that. Wondering about cost modeling for specific lines of business that a mental health organization may provide training, consultation, systems integration work. Yes, absolutely. I think of those as more the support system side of it, and we definitely have worked on cost models along those lines. We did one in Alaska to support the folks that were implementing, I think, their quality rating system. We also have someone right now in, oh my goodness, where are they? Dayton, that's working on a pretty comprehensive cradle to career cost model that includes a lot of these kind of like business infrastructure support sides to it as well.
I'm going to pipe in here real quick and say, Andy, I see your chat here about how to go about this cost modeling for IECMH. And I've seen other questions too in the chat about people wondering if these have been done. And this seems to be a relatively new concept for our IECMH folks. And so we are in this exploratory phase of taking the expertise of Kate and Allie and taking our expertise in the infant mental health world and really marrying them together to come up with something that makes the most sense for your region, your agency, your state. And so some folks might be a little disappointed that we don't have a beautiful, totally well thought out product for you in this moment, but that's also this iterative process because these questions are so nuanced between everyone's examples. And so that's why, Allie, thank you so much for sharing your example about in Illinois. And we really want to see who's interested in starting to really like get in the weeds and talk through this with all of us. So if you are, please let me know. Please let Allie and Kate know, and we can talk about how to do that. The worksheet that you have, Kate, I think is a really great start to the conversation. And I think that's what we have to keep in mind. Like it really is a start of a conversation that will continue as we go through this process. Yeah, Kate, any other thoughts?
I mean, you said it perfectly. It's relatively new in this area. There are only a handful of examples, but what we've been finding and is a big part of our goal at Children's Funding Project is to really have more programs and services benefit from cost modeling. So myself and our cost modeling coach, we're really great at translating these like methodologies that are so ingrained in childcare to other programs and services. We have people one's doing a youth internship program cost model. I mean, really, it's not hard to do. It sounds like it is, but it's actually not hard to do. And we're so thrilled to work with people that want to start cost modeling their services in their area.
Yeah, and the more examples we have, then the more we can show and the more we can replicate, and folks don't have to reinvent the wheel and all of this. So, Kiki, as always, thank you for sharing your Washington example for those curious about the DC-05 and cost modeling as well.
And Megan, I see Lisa just shared the the 0 to 3's cost calculator. Do you want to talk about that and then connect it to what we're talking about today?
Yeah, definitely. So this is a specific tool for mental health consultation. So again, thinking about the continuum services, this is not the full continuum. This is very specific to the promotion prevention service, although I really like to call it a strategy of mental health consultation because then you can envision it as a strategy that you can integrate throughout any part of the early childhood system, mental health system, settings, etc. Although most folks consider consultation, when they think of mental health consultation, I think most folks consider an early care and education setting. But we're trying to change that to be more universal. But so a couple of us got together and I started part of my career was at the state of Michigan at the Michigan Department of Health and Human Services, and I supported our state's mental health consultation team. And there, this is when we were talking about budgets and financing and all of that. Everyone always asks, how much does it cost? Obviously, that's how we came to this conversation here today. And so a couple of us got together and said, how much would it cost, really? How much does mental health consultation cost, or could it cost? And we created this tool. So thank you, Lisa, for popping that in the chat. We were going to talk about that in just a minute. And this, again, it is not going to be the answer to everyone in terms of your questions around consultation, but the idea is that we get a little bit closer to answering some of these questions for you and have a little bit more of an educated estimate when it comes to answering the question of how much does this cost. And we were, Kate, I think you mentioned the concept of ingredients, and that's really what we were thinking as well. Like, I think we might have called them elements, but I like ingredients better. What are all of the ingredients that go into a potential cost around mental health consultation? And so we broke it out into if you were trying to estimate for a program or you're trying to estimate for an individual consultant, and adding in all of the potential costs that might go into that. And the range from endorsement to reflective supervision to travel to a license for a database. And again, the idea is to expand the consideration of what all of these ingredients could be. And so we came up with a calculator. So check it out if you haven't seen it. Let me know if you have any questions. We just recently went through a revision of it. And so it was out about a year ago, actually a little more than a year ago. And we reached out to folks that had used it and said, okay, what would make this better? So if you haven't used it in about a year, go back and check it out because we added some really important things like, sounds silly, but commas and dollar signs, which really make all the difference when you're trying to figure out how to use this tool. Um, and added a couple more ingredients, if you will, as we've heard from those who've used it. So shout out to Catherine Wright from Minnesota and some of our other friends who gave us some feedback on that. So take a peek at that. Let me know if you have any questions, and we'll probably do another revision in about a year or so. So if there's some way that we can make it better, please do let me know.
I'm so glad you just brought that up because I meant to bring that up earlier when I was showing the cost model examples of I'm a huge fan of the calculator. The old and the new version, which is so nice. I use it all the time. Um, and it's similar to like the provider cost of quality calculator that we use. It provides such value, those valuable ingredients to inform if you're doing a system-wide model, because these models that I've showed you never represent one specific program's budget. It's not meant to be a budgeting tool. It takes a lot of data. We clean it, aggregate it, so it is an average of most programs should see themselves somewhere within the cost that the true cost that comes out, but it's never going to look exactly like one program's budget. Like one place might have higher transportation costs but lower
Right.
IT costs, and then it looks a little. It kind of pans out when we aggregate all the data. But we love the calculator because it gives us so much information and filling in data gaps so that you're not overtaxing clinicians and providers and asking for more information. And it's such a nice complementary tool to the work that we're doing. And we're so grateful that it exists.
Thank you for that. You are a numbers lady, so I really appreciate your feedback. And two quick things. One, also, because Kiki, I saw your question in the chat about the start of the 65,000. This tool was vetted with 9 or 10 other national recognized consultation folks, and that was kind of an average that we came up with. It is pre-populated with like some best practice numbers, but the idea is that you can delete those and add your own in. So if you need just a pie in the sky ballpark number, you just go through and look at those numbers and then hit submit, and it will send you an email and a PDF as well with that costed out. And you can also play with those numbers as much as you want, and you can create as many of those versions as you want or need. As we know, we like to make different budget projections, high budget, low budget, that sort of thing. So play with those numbers as much as you need. But yeah, Kiki, that's where that came from.
So I know some people haven't been able to, for some reason, open the sheet. So Allie's going to flash it up and we will make sure it gets emailed out. I would love it if anyone wants to share their goal statement that they came up with. Either, I don't know if people in this mode, if they can talk out loud or if they just need to put it in the chat, either is fine.
I think since the webinar, they can't unmute, but yes, please do put in the chat or in the Q&A.
Yes, thank you. Please put it in there. I did see some chat, which I think is really helpful about coming up with how much clinicians should be paid. And some people are giving responses, which are so great. I want to capture this whole chat. It's often a really difficult discussion point, and there's a lot of resources we have if you want to work with coalitions or committees or tables in your community to try and develop what that ideal compensation scale is. It's a really valuable process to do with your key partners. Let's see.
All right, I'm going to go ahead and pull down this worksheet with the promise that we'll send it out.
I see a question about Seattle that we are definitely the right person to help you if you want to put a ballot initiative forward. Reach out to us for sure. Um, okay. Well, I would love if people keep sharing out their responses in the Q&A or the chat just so we can collect those. I will keep moving on here and we will open it up for more questions soon. So just in terms of us being the people, what you should reach out to us to, what we can help you with. I'll talk about it from the cost modeling piece. Our next webinar will be more about the tax policy and ballot initiatives, which is a lot sexier of a topic than cost modeling, but that's okay because I love cost modeling. So we really understand the power of being able to put a price tag on your goals. I mean, we've seen it be effective. We love working with people and partnering with communities and states to develop cost models and cost estimates to clarify this for you. So we have a couple ways that we do this. The one way is coaching to build capacity. So this is coaching to build your capacity so that you learn how to do a cost model. With this kind of work, we give you access to an interactive online cost modeling course that we've developed, and then we pair it with regular coaching sessions with either myself or one of our cost modeling coaches. So we work with you very closely to build your knowledge, build your ability, and then support you through the process of creating your own data-driven cost model. So then you hold those skills, you can apply them then to other programs, services, goals that you have in the future. But we really imbue you with the skills yourself with a lot of coaching support. Alternatively, we can create a cost model for you in close partnership with you and your key partners. It's still a very collaborative process, but in this case, we do the cost model for you with your input, and then we provide you with the tool. Along with the tool, we do give you information on how to use it, give you the full functionality of it, how to analyze it, how to maintain it and sustain it so that you can use it over time. When I say this, a lot of people then wonder, well, what does that process look like? So whether we're building your capacity or we're doing it in partnership, but for you, we start with defining the goals. So what we just kind of worked on. From there, we help you determine the parameters of your cost model, kind of like the guardrails of what we're going to look at in it, the facility types, the geography, those kinds of things. Then start compiling any regulations related to that. So licensing regs or programmatic requirements, funding requirements. And then step 2 is the data collection process. So first pulling from any available resources, try not to tax people with asking them for more information if you can already find it somewhere. We can look as far as like the Bureau of Labor Statistics or anything that's more localized. Then we see what data is missing, and then we do surveys or focus groups or interviews to fill those data holes. And then lastly, we compile it into this cohesive workbook that allows you to explore different scenarios and see the outcome. I do have these stars here of check it with key partners and providers to ensure accuracy at these different points before you consider it final and to ensure you have buy-in. And so people often ask, well, who are those partners? This is kind of how we recommend you involve in your cost modeling process. Again, it looks different in every context, so we are open to that. But first is the local lead. That's whoever initiates the cost modeling process and kind of oversees it. So if you're the one initiating it, it would be you or your organization. The other people that need to be involved are direct service providers or clinicians. They participate in those interviews and focus groups. They provide really the most valuable information and data on the true costs and challenges and what it looks like really on the ground doing the work. And then the third is the working group. And this is a group that's nice to have to help you make decisions throughout the cost modeling process. It also helps connect if you don't have a connection to the right providers in your community. They can help connect you to that. They can help you with decisions around assumptions and data inputs. And then the timeline to create a cost model, on average, it's about 9 months. The longest, as you'll see, is the data collection process because that can really vary. Sometimes it's easy to collect data, sometimes it's really hard. If we are doing the cost model for you, I generally say it takes between 6 to 9 months. And then if we're coaching you to do it, it can take anywhere from 9 to 12 months. So I'm going to stop there, but I want to leave you with what if this is a process that you are interested in pursuing, these are some next steps I would recommend. The first is to discuss your goal statement with colleagues and partners. Get other people's input into it. Think about who are the most impacted, how feasible is it, are there competing interests, and it's nice to have that input so you can start to gain some general consensus in your area and some buy-in. Then, like I said, start collecting any existing data that might be out there. If reports have been done recently, start gathering those and also educating any key cost modeling players. So starting to talk about it with mental health consultation groups or home visiting groups or whatever it is, start talking to providers and clinicians so that they understand what you're doing, why people are going to be asking them for information, how it's going to benefit them, that it's not meant to create new requirements that they have to fill, that it is really a process that you're undertaking to support the sustainability of their work. And then you can reach out to me if you want children's funding project support. I would love to work with any of you. I think this is a really ripe area to benefit from cost modeling. And I also encourage people to attend our next webinar that is on October 21st with the revenue folks. So I'm going to open it up for questions. Let's see.
I want to pop in real quick and say, someone who put a Q&A in the chat, it says anonymous, so I'm not sure exactly who you are, but they were talking about how there's an assumption that that a consultant is a salaried position. And you are correct. That was version number 1. However, in version number 2 that just recently came out, we put additional line items in there to recognize a consultant, like flat fee or flat rate or whatever you have. So if you haven't checked it out yet, please do. Again, that was from feedback from some of those users. And if you, again, if that doesn't quite fit your needs or you want to talk more about it, please email me and happy to chat more about it.
Someone put in that they're curious to see cost modeling around clinical mental health services or IECMH consultation services. I think maybe Allison put one in from Illinois. I'm definitely familiar with that one. There might be another one that I can pull up that I can send to Megan so she can send it out to this group. Someone asked about New Mexico. Yes, they have a cost model out that is a tool to help them get towards universal childcare. Similar to Vermont, Vermont is working towards universal with higher using they're also working towards a wage scale for childcare providers. We definitely have a report on New Mexico that we can share after this. It's been published.
There's also a bunch of goal statements in the chat too.
Great.
If I don't know if we want to read a couple out loud or what, but
Yeah.
I wanted to make sure you saw.
Ooh, I love it. Okay. Our cost model should enable us to understand the cost of therapy help in our center for the children ages 2 to 5 in the high requested areas. That's great. That has every component. It's really clear to see the parameters as well as what type of data would need to be collected. That's a great goal statement. Our cost model should enable us to understand the cost of providing infant toddler care for vulnerable families that cannot afford to pay for care and for whom we may not receive a stipend voucher reimbursement, while also paying competitive, livable wages and benefits for our staff to reduce turnover and support their quality of life. It will help us estimate the cost of providing full pay child care for those who can afford it, while also providing low to no cost care for families that cannot afford it for 24 infants and 20 toddlers in a child care center. This is great. This is very detailed, very quantifiable, even quantifying the staffing needs. And I'll read another one. Estimate the true cost of increasing trained IECMH professionals to be available and accessible for infants and toddlers in high need zip code areas and resource deserts. That's fantastic. We did do once a long time ago, I think when I was still working in Illinois, a cost model for infant toddler specialists. A little bit different, but same idea. And it was kind of piloted out as a program for higher need areas that then became adopted by the full state. These are great goal statements. I love them.
Another question, this last question in the Q&A, is there a site to access Florida's cost model if they have one? Can you give it people dig to look for cost models in their states?
Sorry, it cut out. What was the last part?
Can you give some guidance for where places people can dig around for if there's cost studies or cost models in their state?
Yes, that's a great question. We have one resource that again I'll share out after this. It's kind of just a spreadsheet of cost models and links to them. I don't think it's fully updated though, which is why I didn't bring it with me. Generally, you can look in 2 to 3 places. So, um, your state agency that administers whatever program it is you're interested in, look through their published reports. That's where, and they share them in different degrees. Like Delaware is a great example. They share the report, but they also share the tool, the cost modeling tool, which is very rarely seen. Normally it's just the report. But I know like New Mexico has theirs, Colorado has theirs, and Minnesota all on their administering agencies' websites. The other place that you can look is if there is some kind of policy or advocacy leader in the field, they will often have it on their website. And the third is if there's some kind of like network group, like for example, family child care networks are a lot of places have very robust ones, and sometimes they will have links to reports on their work. So if there's anything similar to that. Um, I don't see the Florida one, but um, I would have to look for them specifically. I know they have a children's cabinet that's been working on a child care cost model. I'm not sure if they have um, early childhood mental health costs. They don't yet that I know of, but
That's a great tip in the chat. Cost model in Washington, cost models are often submitted by state agencies to the legislature as part of analyzing proposed bills. That's great. All right. Well, maybe, Kate, do you want to flash the next steps slide again, just in case anyone has questions about, you know, the action? Maybe it'd be nice to see in the chat if folks want to drop in sort of a next step for themselves that they want to take using this information from today to kind of push forward on cost modeling in their states. We'd love to see that and see how we can support.
Oh, and I love that comment. It's always fantastic when cost models have been completed before we are in the thick of legislative session. So true. It's nice to have the numbers at your fingertips. And that is the nice thing about cost models is that we build them with longevity so that it has enough flexibility in it that you can use it year after year as different proposals come up. So Delaware is a place that we work with year after year. It's the same model. Sometimes we have to make larger tweaks to it, but usually it's really small tweaks. And they use it every year to meet with their legislature and their budget office and the governor's office. And they're another, I could have used them as the success example. They have every year chipped away at the pieces they're trying to make because they have those numbers ready. So, yeah, that's a really good comment.
I just want to riff on that just a little bit more in recognizing the current fiscal season that many of us find ourselves in to this concept of being ready for the next opportunity. So I know many folks are in the process of trying to protect the funding that we currently have for the work that we're doing. And if there is this, when there's an opportunity that's going to come back around for additional funding, to have those numbers ready, to be prepared, to have even just go through these exercises. So it's sort of, it's top of mind and you, whether they say, here's your budget for this year or what does it cost, that you can respond to that quickly. And that very much is the difference between programs and services and systems that can be proactive and successful, and those that really just kind of get caught in all the conversations around budget cuts. And so.
I do see a question about specific about Los Angeles losing funding. I don't know the specifics of that, but I do know one of our colleagues at Prenatal to Five Fiscal Strategies, they do cost modeling work and they have worked with Los Angeles. I can give you their contact information because she would probably know.
And I've seen that there's a couple international folks on the line today and asking if we work with international partners. We're historically our work has always been in the United States, but our courses are actually pretty new. So I don't know if I imagine our courses would be open to anyone who wants to take them. So we can share more information about that and touch base with the Children's Funding Project team. Thank you so much for that question.
Yeah, I see someone else who is looking at cost and financing strategies to revise evaluation policy, provide ongoing training and ongoing support to the clinical workforce statewide, serving children under 6. Um, that's great. We've started moving into that world of cost modeling, those types of PD support services for programs. So that's a great area to move into if you need any help thinking through it. Oh, Vivian has to change diapers. Thanks for coming, Vivian.
Kate, did you see Andy's question in the Q&A about cost modeling help with the macro system around recommendations for reimbursement services? I have thoughts, but I'm curious what yours are.
Oh, I think if I'm understanding the question correctly, yes, absolutely. The that's a big, it can be very focused on that so that you have a lot of variabilities to play with different reimbursement and service rates. But even that system example that I did show you, their quality levels were actually essentially compensation levels for the workforce. So that's a great way. And the other thing that we've helped people use it for is, like in Boston, we did a funding formula to help with that, but you can use it for to develop supportive reimbursement rates, but also to develop like grant and stipend programs if that's a different implementation method that works better for whatever system you're in. I'm not sure if I answered that question correctly. If I didn't, let me know.
So I'm trying to keep up with all the questions in the chat, which chat in the Q&A, which is very active, and we love it. But thank you for your grace and giving us a little time to respond to all of these. I put my email in the chat and received quite a few emails from the first webinar. I expect to see the same. So if you don't hear from me by the end of the week, please feel free to nudge me again. But yeah, we want to keep this conversation going and moving, and we're open to getting into the details as much as we can with your states and the individual questions. Allie, I think you and Kate put your chat or your emails in the chat as well. And I think those are most of the questions. Is there anything else that you two want to add before we wrap up today? Maybe even a little early for folks?
I will be sure, Megan, to follow up with you on some of these resources that folks have asked about. I really love the questions that have come in. People are so thoughtful. We'd be so excited to work with people on this and to partner with 0 to 3 with the calculator and use it to inform cost models. I think we're in a really exciting place to do this now that we've started to expand our cost modeling work into other areas. And I think it's just I know I'm a cost modeling nerd, but I really think it's a helpful tool in moving towards more public funding of these important services.
Yes, and these folks are at the cutting edge of making these decisions for states and systems, and we really do need to start thinking more creatively about how we fund and the policies that we have to sustainably support each of our states and systems, and even locally as well, regionally and locally. So again, Allie and Kate, thank you so much for your time today. Renata, thank you as always for helping us behind the scenes and do everything as smoothly as possible. We will follow up with I think we will include the chat. I think we can do that in the follow-up email. Since there's so much activity there with recording and yeah, let us know how everything goes, and we will be in touch soon. Thanks, everyone.
Thank you.